Thank you very much for coming to the meeting. This is the 10th weekly meeting for training and logistic. We're trying to streamline and make it more effective when we're providing training in Tanzania. So as I said, this is the 10th meeting. We've been meeting with leaders from Tanzania and leaders from different hospitals to try and make sure wherever we are planning to go and teach is applicable or useful from our colleagues in Tanzania. In one way, we try to identify the area that we think we can address, which is help baby breathe, that's the main one, and postpartum hemorrhage, that's the second top for acute setting in the hospitals. And then, of course, in the hospital, we do have, when we go to individual unit, we have thermoregulation for the newborn and newborn assessment. And then, of course, some of the assessment for diabetic, identifying the patients who are at risk for diabetes and for postpartum hemorrhage. So those are individual areas, but the main things that we'll be teaching in the hospital will be the help baby breathe and the postpartum hemorrhage. So the logistic part is that provide a lot of challenges is we're trying to combine all those three hospitals in one area to get the training. And that's the part which we've been back and forth, and the reason of having these meetings, because we were trying to impact a lot of healthcare workers at a very short time. Because if you guys know, the medical mission is only from September 12 to 24th. And then of course, start working on this September 13th. To the 23rd. So those are like packed days, and we want to maximize our time and use the most volunteers to deliver that education. And we do work with Minister of Health, Mr. Saturin, thank you for coming. We do work with the leaders for different hospitals, Mr. Jafari from Muhimbili as a midwife there, so thank you. And then we have, of course, we have today in meeting the people from QHSC members and friends. And let me see, all of them who show up, except our very own secretary, will be coming to Tanzania for the medical mission. So we do appreciate you guys spending the time or setting the time aside so we can come and join us to make sure you provide your feedback so we can learn and make it better. So with that, again, welcome to the 10th QHSC Logistic and Training. I am gonna try to share my screen and see what we have for today, but if anybody has anything, burning questions that we can address before we start, that will be the time. Anybody? Somebody? So I am gonna share my screen, and then I'm gonna mention things that we were working on from previous meeting to as of today morning, this morning, and then what we're planning to discuss today. Okay, so let me share my screen.
I think
for this meeting, we want to update so far the training. We've been doing training weekly and sometimes maybe every other week, just to make sure we are online with what we need to do. We're going to review a little bit of what we have been discussed for this meeting up to the 15th. That was last week. We're going to finalize the schedule, things that address on the schedule, things that we need to cover before we get to Tanzania, and then of course the open discussion, which is going to include about the discussion about the invitation letters, permission for the room reservations, and things that we need to prepare before we get to Tanzania. Okay, so this is just a quick background. We have so far 6 educations we've done, and I don't have to repeat that, but the last one we did was yesterday, which was covering the diabetes screening and management during labor. We had Dr. Gideon Mlawa from United Kingdom. We have Dr. Aminata and Dr. Murugat from Mwananyamala. And then we have Mr. Jafari from Muhimbili. We have Ms. Neema, but I think she was sick, so she was not able to attend, but she did provide some feedback. We had Dr. Emma Kurwa Mugeri from North Carolina here in the United States. And then we had like 25 people, but some of them were in group. We know like Dr. Gideon Mlawa had 5 people from United Kingdom. And then we know Wananyamala had a few people in the group, so we're gonna get the final tallies, but at least we had close to 25 people. Next training is next week, that's postpartum hemorrhage, and this is for like OB part is the biggest one, and because we know from the statistical standpoint, we have close to 50%. I think the actual number is like 46% of the maternal deaths are contributed from postpartum hemorrhage. So this is the area that we believe there's a lot of preventable death, and we need to address those things. And to start with, we're going to try to identify the risk factors and try to get all our healthcare providers put our heads together and to try and figure it out and try identify how to identify this patient, when can we need to make those decisions, and try to address the fastest way to take care of these moms who just delivered. She needs to be alive to be able to take care of that baby. So we need to address those things. So next week, it's going to be a lot of discussion. So we welcome anybody who wants to come and learn about that, and that will be great. And then, so for the next month of August, we have still go back to the Help Baby Breathe group. I think they have 2 more discussion, and Dr. Msambi-Chaka is going to give us the update, and we post those links later on when they're needed. I mean, they're ready to go. We do know how many we're going to teach. We don't need to repeat that. So we did have some updates from last meeting, which includes we still are planning to have the all facilitators to work together, but it's a little bit different because when we were asking for this or recommending for this, we thought we are going to have national facilitators from Tanzania helping us. So we want to make sure all the people who are teaching are going to be with us, but for unforeseen reasons, majority of them are not going to be there as that capacity. So we are blessed enough to have Mr. Jafari, who is going to still continue working with us. And so soon we're going to give that schedule. Majority of the people are going to be from the global volunteers. We do have, I think, extra 4 people through Dr. Msambi-Chaka from Tanzania who graciously enough to agree to do their volunteer time, maybe not for 4 days, but at least 3 or 2. So we appreciate that and thank you very much. We do have through Dr. Mulungu, anesthesiologist from Muhimbili, has said he's going to provide at least 3 people, specialists, I believe, to come and help us with facilitating the postpartum hemorrhage. So we are still working on it. Once we finish the training next week, we're going to have a better understanding of who is doing what and when and how many people do we need on those stations. So it's going to come, the schedule definitely is going to be given out with the people in the list for this, the end of this month. We did get an update for Mama Natalie from Muhas, I believe. So there are 6 of them, but 3 of them are working. And then so we're still working on a couple of things to try and make sure that we have full 5 tables, 5 stations during the training. Or if we can get more, then it might be 10 stations, which we accommodate more people, but we're still working on it. And by the end of this month, definitely we know where we are. And then, of course, we do still request the meeting for all the administrators who are making the decision from those 3 hospitals. And of course, from school to meet with us on the day that we arrive on the 12th in the afternoon when we're eating lunch. So hopefully they will be able to come so we can put the name and the face to face so we can get to know you guys better, because we have communicated with you by WhatsApp or emails or virtually, but we want to be able to see and shake your hand and say, you know, thank you for all you do and allowing us to come to your facilities. And I will stay working on getting more information from, update. And I know Mr. Saturin did send me the information for the, especially training for those face-to-face. We update when we're doing those schedules, as I said, by the end of the week by the facilitators, when are they going to be, where are they going to be, and what equipment are they going to use. So because all our goals is to make sure we see or we work with a lot of attendees, like as much as we can, 400 to 450. If the anesthesia group also we come in, I believe Dr. Mulungu said at least 10 trainees will be able to join us. So then at least we can spread them around for each training to be able to say, because we do need anesthesia department on any and in all obstetric emergencies, because we know these moms will lose a lot of blood, so we do need those anesthesia to be there to help us with the airway. So when we have those scenario or mock drill, we do want anesthesiologists or anesthesia department personnel to be in each group, because we do work as a group. It's very hard to say, okay, as a nurse, let's pretend I'm anesthesia, but I'm not. So I'm gonna probably have less experience on that area role than having an anesthetist there or anesthesiologist. So we appreciate for Dr. Mrungu to provide those 10 nurse anesthetists or anesthesiologists attendees to come and help us with every single scenario. And also, of course, we thank Madam Zuhura, who is also working to help us with the nursing department at Muhimbili to make sure we get as many people as we can. And there's a lot of logistic behind continues about scheduling staff or scheduling people off time during that time. So it's an ongoing process, but I'm sure Mr. Saturini has some more information, or Mr. Mbinda if he's here. Oh, Mr. Saturini came back. Okay, thank God. So he's going to give us some update from that. So with that, I'm going to let Mr. Saturini, if you have anything, feedback from what we discussed, from anybody who you communicated from the previous weeks, if you want to inform the group today.
Thank you.
Hi.
Hello, everybody.
Hi.
Yeah, today I don't have much to say, but I think you have highlighted that we have secured some equipment from MUHA's Skills Lab, the Mama Natalie and Baby Natalie, with the, I think the amount I shared with you. Unfortunately, I was not able to get them captured by camera so that we can see them exactly how they are, because they are, I think they are a little bit busy with examination and some stuff there of academic. So that only what I have for today. If you can remind, is there anything that I was also supposed to update with the equipment price? We had a confusion on the amount of was it mask or what? It was sold 9,000. So we were not sure if it is a one piece or a set of a certain number. So I requested Mbinda to make a follow-up so that we can is a one piece or not. But otherwise, I don't think I have much to share today. Thank you.
So we were asking about the newborn mask, because the price that we saw from Lido Global Group, they are selling, I believe, 10 as a one package. And so the price that we had was, if you say one quantity has 10 masks in them, but the ones that you give us, we just say 2 pieces. So we were asking, is it 2 pieces of 10 masks each? That means 20. Or is it 2 pieces, just 1 and 2, and that's it? Because if that's the case, that price was too high. And I mean, I'm glad if you say Mr. Mbinda is going to follow it up to try and, you know, like identify and see if is it in the package or is just in a single item in each package.
Yes, Mbinda. I'm not sure if Mbinda is around here, but he was making that follow-up.
Okay, no, I don't see him on the list, but I'm sure he's going to see the video and we can just send, let me put my note here.
Yes.
So that was the newborn mask. And I believe, I know Dr. Msambichaka just stepped in now. Yeah, so on our side, because you're running out of time right now, yes, 49 days. To go. So we are running out of time, and I believe Dr. Msambichaka has secured some of the resources we need for training, and she's already ordered them because we do need them like now. So we be sure that we have them when we show up in Dar es Salaam. And I appreciate you and Mr. Jafari giving us those feedback from having the actual waking mama natally and actual waking baby neonatally, because we need those to be counted when we're doing training. As I said, every single person who is doing training needs to touch the equipment so they'll be able to practice, instead of saying, okay, this is how you do it, and then everybody watch one person. No, we want every single person who shows up there touch those equipment. I know, Dr. Msambicheka, you came in a few minutes, we started. I don't know if you have anything to say about the equipment.
No, I really don't have any updates right now. Just waiting for them to arrive to get a better count of what all is available to us.
You're at work.
Yes, I'm only going to be on this call for like 30 minutes.
No, I appreciate that. No, thank you. I know you told me that you're going to be at work, so I appreciate even a second you give us. So thank you. Yeah. So another thing for Mr. Jafari about the equipment. So we are sure that we have those working mama natali, because if from MUHAS we have 3, and is MUHAS you guys, or MUHAS is separate for the college, and you guys are in the hospital, you have separate mama natali?
Actually, it's separate.
Okay.
Yeah.
So how many do you have?
As for now, I have only 2, Mama Natalie, in labor ward there, but I always depend on Tama.
Okay.
Yeah.
So if MUHAS has 3 and then Muhimbili has 2, so that's 5. And then so now we need to find it from Tama, the working ones. So then those ones will help us to do to count those stations. Either we put 5 stations or 10 stations, and how many people can come and how many scenarios they can have. Because we want to at least see every single person. I mean, we know for postpartum hemorrhage, you want at least twice. The first time they're gonna try and you give them feedback, and then they need to go back and perfecting their skills so they can remember that sequence of events to be able to perform them as being observed. And then hopefully in the real life, they'll be able to perform effectively and save that mom's life. I know it's something that came up after the last meeting when we were discussing. Dr. Mkonye did send me information asking me about the non-pneumatic anti-shock garment, which I think some of the places in Tanzania are using that. So it's an equipment that at least you can save instead of the surgery. You can save this mom to, at least during transport, to help them so they arrive where they're going to be a little bit stable, so then tertiary center or Muhimbili or Amana can take care of these patients and hopefully save their lives. So I mean, there's more discussion for next week, but some of the things that they were discussing about that equipment is it's helpful, and that's World Health Organization and UNICEF are supporting that equipment. So, and I believe Dr. Gwen, you're here. If you can just give a little bit that what we were discussing before, just to show to share what we are doing right now and to get some information about that equipment.
Yes, it's the non-pneumatic anti-shock garment, and it's proven to be a sort of innovative strategy, which is kind of proven to be life-saving to stabilize patients during postpartum hemorrhage. Like if you're not able to adequately resuscitate the patient and care for the patient, this buys you some time so that maybe outcomes will be better. And so in terms of the WHO, they really define postpartum hemorrhage as any blood loss greater than 500 cc's. And so sometimes we say we're looking for a liter, but a liter is really too late. If the patient has already lost a liter, then we're really up the hill, going up the hill without a paddle, pretty much. Now, these non-pneumatics, they come in different sizes. There's a small and then a medium and large. So I've been online today. Apparently, you can get them through UNICEF. So I'm investigating now the price of it, because it seems that they have to be purchased through UNICEF. And I guess depending on the area that it's going to, the prices are different. So I'm waiting for a response. I sent 3 emails out today, this morning. And so I'm waiting for a response to figure out, you know, if this is something that we can purchase. And if so, then we really need a small and the medium large at each facility. And that's pretty much what I have to say about that.
No, thank you very much. I just wanted people to have an idea, especially Mr. Jafari, who is going to be in the middle of training.
Mm-hmm.
Know that there is a possibility we're going to add to the training for the postpartum hemorrhage event. So when we were discussing earlier, that's my idea came back, because that's why Dr. Msambichaka and Dr. Fabian Guido and Mr. Paranka, we were playing around with the Help Baby Breathe equipment. The same thing that you find a source that they're saying they're selling to the limited resource area. Of course, Tanzania qualify for it. However, when you say, when you buy, you have to deliver them in Tanzania or get them from Tanzania. That's the issue that comes. And then we are back to square one. When we get to ask the vendor from Tanzania, they charge us 3.5 times. So that's the process that we're gonna find out what you hear from the UNICEF people, but I'm hoping that either there's another way of us either buying without waiting to go to Tanzania, or if we're buying from Tanzania, the price should be at least comparable to what it was either online or something like that. And I did send a message to Dr. Mkonyi, because she's the one who initiated and asked for a question. And I said, if we have any vendors in Tanzania who might have, because she has seen that being used, so who might have that, so we need to find out also the cost and see how much it is. So if it's the prices are comparable, then we can try definitely and get those. When we're providing education, then we do need to be able to give to those equipments to each hospital that we have something, especially Buguri and Mwanza, because they're the ones who are transferring the patient back to Mozambique.
Right.
If we,
the highest price I saw was $90.
Mm-hmm.
So I don't know, how that equates to all the different areas, but that's the highest price I saw.
Yes, so we, as I said, we figured it out, all those logistics part, but also sometimes with that, the shipping, Dr. Msambichak,
Yeah.
The shipping almost is more than what you're buying, so it's a little bit catches interest. But we're going to work on it, and that's why we're trying to see if there's any vendor in Tanzania who are comparable prices to like either UNICEF or the ones that we see online. So if the prices are comparable, then definitely it's easier to buy from Tanzania, so we don't have to have that huge shipping.
Right.
Mr. Hopefully, have you ever seen that, Mr. Jafari? Do you know where we can get it?
Actually, NASAG we are using, but it's for, especially for primary facilities and other referral facilities, but not in here, especially in Dar es Salaam. Most of the time, they're just using it from the other region.
Okay.
But we have it and we are using it.
Okay. And so you guys, since the people are using that equipment, they're coming to your hospital, do you guys give them the training, like how to use that, or no?
For those who are using, actually, they had a training.
Oh, okay.
And the bad thing is, especially here in Dar es Salaam, so far there is no a big hospital that they have those NASAG.
Okay. And I think I did speak, chat with Mr. Bashir, and I see him on the line there. We were going back and forth to try and see if they have used from Buguruni. And as I said, because that's the part we always worry, just in case if they can't manage that patient, they have to transfer that patient. The en route care is what will determine how the patient is going to be, the outcome of the patient once they get to the receiving hospital. So as I said, we're going to get more information, and by the time next week, at least we're doing the training, we might add more information. And then, of course, if we are able to secure a few of them to bring during the training in Tanzania, so then we do that. But that's just something coming on, and I know Mr. Satwini is back. So then my concern or my fear is we might end up with the same situation that get our colleagues in Tanzania to get it from the vendors there, and the prices is 3 times, and we cannot afford that. So it's unfortunate. I'm hoping this time from UNICEF it doesn't go that way. And if they let us buy from here and then we bring it with us, that'll be fine. But that's just something that we can anticipate. And for people from Tanzania, if you can help us guys to see if you know the vendors who is selling them, how much are they selling the prices, so we can start planning. As I said, it's only 49 days left. And we're counting down fast. Okay, any other question about those equipment? No? Okay, so we're gonna come back to the reason for, agenda for today, which was to talk about the invitation letters. I know Dr. Msambi-Chaka has worked tirelessly behind the scene to try and secure the letters from different places so we can come and do the training. And Dr. Msambi-Chaka, are you able to speak on it? Because Mr. Saturini is here too, if he can help us.
Yeah. So I was able to get letters from Mwananyamala and Buguruni. We hit a snag with Muhimbili. And at this point, we still need some sort of, I think from a visa application standpoint for the people that will be traveling, we probably should be okay because one letter should be sufficient. But in order for us to be in compliance with like the institutional policies, we still need some form of introduction in terms of a letter. And so is Mr. Saturini on this call, by the way? So Mr. Saturini, one of the recommendations from Muhimbili was, can we get a letter from the Ministry of Health, because we are working with you to introduce QHSC to Muhimbili to say, QHSC is coming to Muhimbili, Mwananyamala, and Buguruni to provide training, and they are working with us, and therefore, I'm not sure what the right wording would be if it's coming from the ministry, but pretty much we just need some letter of introduction so that we are in compliance. We don't want to be going to an institution without an invitation. Is there something that you can help with, Mr. Saturini, in that regard?
You mean a letter from ministry to Muhimbili?
Yes.
Introduce you to Muhimbili?
Yes, just a letter ambayo tunaweza tukaonyesha Muhimbili to say we are actually working with, we are here to provide training, and we are working with you on this as well. And, if they could allow us on their campus. Because the people that so far we have, people like Mr. Jafari and stuff like that, they cannot write that letter. Just say that.
Okay. I think that letter is, it is fine that minister can write to Muhimbili, likewise to Mwananyamala.
Yeah, I think it can just be in one letter, to be honest, Mr. Saturini, that just says that this is QHSC, they're coming to train, these are the dates that they'll be there, and they will be at these 3 government hospitals, and please accommodate them. And it should be just like a letter, and Harriet can probably just send you like the wording, but we need some sort of, since Muhimbili administration is asking that we ask for a letter from the ministry, so I think we need some letter of introduction. So I guess the question for you is, are you in a position to write that letter, or would it have to come from somebody else?
We can write it. We can facilitate and get that letter. However, it is important that we attach also with whatever the temporary registration or whatever from professional bodies so that it is easier. We attach with them together so that it is easier to access the clinical area and everything by having saying these are healthcare professionals that are recognized by our professional regulation bodies.
So we
Like
don't
for
need
doctors,
access.
MCT,
We don't need access to the
LMC.
clinical area. We don't need access to the clinical. I'll send you a reason why we don't need like the access, because we're just training. We're not going to be touching, like performing any, we don't need clinical privileges,
Okay,
if I could put it that way.
So it means that you will not access the wards and everything. So we will just do a training in the simulation room. Is that right?
We will do the training. If we visit the ward, we are not primary at all. So we are not like primarily treating, diagnosing, or making any recommendation at all. We are solely there for training purposes.
Yes, and that is actually, maybe I will find out a clear definition from the professional regulation, because sometimes they say somebody can enter the ward if they're professional recognized.
Okay.
So maybe I will find out, maybe because we are not going to interact with the patient. If that is the case, then I will seek a clarification, and next week I come again. I will update before next week.
Okay.
No, going to the units, we're able to go, but for example, for nursing, let's say I'm going to teach about thermoregulation changing, covering the babies. I am going to be there with the nurse or somebody from the hospital with them while I'm talking, but I'm not going to access the patient's chat by myself. The nurse or the doctor, whoever is there, is the one who is going to be there by conversing, discussing, but not making, okay, this patient should get A, B, C, D, like right now, as a person who is providing those orders. Education. Go to the unit and see the patient or the baby, or they said, okay, this is how you do, like a blood pressure. We are teaching them versus say, okay, this is the blood pressure. You need to give this medication, this medication. No, we cannot do that. But I can say, I can teach a nurse, okay, this is how you put the manual blood pressure on your hand. This is how you palpate for pulse. This is how you do massage fundus, but not decide that I'm going on the patient's chart and start reading those stuff without the nurses there with the doctors. Does that make any sense?
Yes, I understand, and that's what I'm saying. I will find a clear definition because I had an experience with Australian. We are collaborating with the Australian, just accessing for TNMC. They were saying that if we will need to access the ward, regardless of what we are going to do there, we will need something which is showing that. So, but I will clarify it after seeking a consultation to both MCT and for nursing, for doctors and for nursing, that we are going. It is like a teaching in the ward. That is actually what is going to happen, demonstrating some skills within the ward, but not accessing the patient information. It is not about accessing the, making some interventions to patients. So that kind of explanation, then I will find their reaction.
Yeah, that sounds good. I'll also send you like just a document that would define kind of like the scope of what we're talking about, which exactly is what you're saying right now.
Yeah.
Okay, and so then that leads to us to the next part. So definitely from Muhimbili, because that's the area that we need to do those 4-day training. We need to be able to get that later as soon as we can, so we can get that permission to be able to ask for the reservation of those rooms, because we need to know we have those rooms for 4 days. How are we going to move stuff around? Are those rooms going to be available for us to come and teach? And if there's anything that we need to do ahead of time, we need to do it now, because we are running out of time. And then so that's just tied to what you will have in that later once it's reached to the person who is supposed to give us permission, then yes, we need to secure those rooms. I'm sure Mr. Jafari will help us with the room, because usually you guys use for the training or conferences. So you help us to know if those dates are already reserved by other people. So then we need to make an arrangement somewhere else.
Now, Dr. Mshiro is looking into that, Harriet.
Oh, okay, perfect. Then.
Yeah, Dr. Mshiro is looking into that. Yeah, I think like I just
actually,
go ahead.
Actually, I have a response on that, because before we started this meeting, I had a call from Madam Zura, and she already talked with the director of research and training, and the plan of reserving the venue is already in place. So I can assure you on that we will have a venue.
Okay, can you just confirm what, can you let Dr. Mshiro know so that he's not duplicating the work?
Yeah, I'll do that.
Thank you.
For the volunteer, anybody has any question about that area? No? Any questions you guys have? No?
No, we don't.
Okay, thank you. Okay, so the last part for the meeting is the training schedule. So we did provide this, let me see if I can share again my screen. We did provide the schedule from in the last meeting, and we wanted feedback from our, sorry, it's gonna move fast, sorry. Oops, I'm missing my schedule. Hold on a second. But anyway, I think wrong document. Anyway, when we had the training, we had like 4 days worth of the training, and we had those 4 days covering Help Baby Breathe and postpartum hemorrhage. So when we have those training, we had my screen is there. We discussed that we're going to have people in the morning and then following up with people in the afternoon to make sure we have enough facilitators. And that's the time that we were hoping for the national facilitators. And I think Dr. Msambichaka, you came after when I was talking about, we had, right now, as of now, we don't have national facilitators coming on their role as the facilitators for this training. Oh, I found it. Sorry, let me go back to my screen now. It'll be easier for me to speak if it's showing up on the there. Okay, there we go. So we had the Tuesday, Wednesday, Thursday, and Friday. That's the Muhimbili area. You know, we have the first 2 hours or an hour and 55 minutes for Help Baby Breathe. That are going to be distributed in 10 sessions. And then Dr. Msambichaka is going to be in charge of that area. So we're still working on those little details. But I said by the end of the month, we're going to have individual people who are facilitating each station, so we can have at least an understanding how we are going to run this situation. And the meeting was scheduled for the 29th. We send the meeting invite letter for the facilitators. So at least we know what topics are we covering, how do we address these things for Help Baby Breathe and also for postpartum hemorrhage. And also to know each other, because we're going to be teaching all of us. So we need to know things that we need to catch up and address when we're teaching. So the second part of the morning session is a postpartum hemorrhage. As I said, it depends on how many Mama Natalie we have or Mama you. And if we can get that device, then neo-pneumatic anti-shock gametes. So then we can see if we have 5 stations for the postpartum hemorrhage or we have 10 stations. So as I said, for postpartum hemorrhage, you can have 5 and have 2 groups in one station and then just rotate, like switch back and forth. One perform their skills, the other one observe, and then the other one perform, and then the other one observe, and then you increase the interaction by people asking questions. So at least you can, because the mannequins are few and we don't have enough to cover all the 10 stations, then we do that way. But for any chance that we get 10, then definitely we can spread up every group we do twice, and that's how it's going to be. So that's the morning session. The afternoon session for the first day, we're going to start with the postpartum hemorrhage again, because of member logistic of scheduling and moving the tables and stuff to accommodate the stations. We are learning that day, but any other day, it'll be always help baby breathe the first thing, and then the second thing is going to postpartum hemorrhage. In the afternoon, again, help baby breathe the first thing, and then afternoon postpartum hemorrhage. So that's just the changes in the first day, so to accommodate, because we don't know how much time it's going to get us to change from one training to the next. And then of course, lunchtime, we still have to figure out to make sure the facilitators do not leave the venue. We have to be able to provide lunch and get them back to work. And for the lunch, I mean, we're going to work out a little system that if maybe we'll help baby breathe, finish eating earlier than postpartum hemorrhage people, and then we switch. Those are logistics that we're going to work to try and save time, because we're going to have to adhere to that time, because people who are coming to training, they have to go back to work or they have to go home. So each individual person who is attending this training from Tanzania, they have to have the 4 hours block of time to come and attend. And the person who is attending on Tuesday afternoon, it's going to be on a Tuesday afternoon. They don't come back because they will get to those 2 training, and that's it. So every single person, we're going to see individual person every week. I mean, every day versus one person coming 3 or 4 times a day. Does that make it? That is the plan we are hoping. As I said, right now, by the end of the week, we're going to have to inject the names of the facilitators in each station. So people will know, I'm going to be in station number 1, station number 5, whatever. So when they come in the room, once we already set up, they will know station number 1 is this side. So they walk and instead of start looking, okay, where should I go here? So we have to have all those details to the last second. Who is doing what and where and how and with who. So all those things have to be itemized that way. But for the our colleague from Tanzania, for scheduling purposes, your staff, nurses and doctors, anesthesiologists, and whoever you bring them there, your staff have to be there for 4 hours. So 4 hours in morning session or 4 hours in afternoon session, and that's it. They're gonna come only once and just 4 hours, so they can get those 2 training. So for scheduling purposes for you guys, yeah, so you have to say maybe, okay, Height is Tuesday morning from 8 to 12, she's gonna be doing the training. Okay. Paranka is going to come Tuesday afternoon from 1 to 5, and that's it. So you need to put those groups of people on those days to match it. For facilitators, then yes, it's going to be, okay, maybe Height and Bria are teaching this session. Okay, Dr. Gwen and Maricela is teaching this session. Mr. Jafari and maybe Miss Lacey is teaching this session. So that's how it's going to be, to that detail. When we send it to you, then you know for sure I'm going to be on the second session, I'm going to be table 5, and then when I walk in there, you just walk on table 5. You need to have A, B, C, D things that you're going to be teaching during the postpartum event: observation, the charts, the skills, and whatever you need to do. The same thing for Help Baby Breathe for Dr. Msambichaka. She's already organized those things. You're going to have A, B, C, D, your equipment, your table, what, those things, it needs to be that detail. And once we call those meetings, please, if you're going to be facilitators, please come, because we don't want anybody being confused that day, because things have to go so fast. We don't have the luxury of saying, okay, we can start at 8:30 because we have few people late. No, we don't have that. We need to come and keep adhere to those times to make sure it goes by the 5 o'clock, everybody's done who is scheduled for that day. That's it. I know healthcare workers, sometimes happen, emergencies happen. Some people be pulled out from training just because. I understand that part, but also we have to know that if you pull those people out, you add them another day. So chances is, if the ratio for training is 1 to 6, it's going to be 1 to 8. That means some people might not have enough hands-on equipment to practice. So that's the risk that we have to accept when we were there, just because healthcare workers doesn't come with rules. It's always changes. So any questions from anybody? Anything that is left for us to address, cover about the schedule, and so Mr. Saturi, Jafari can help us.
Oh, no, I was going to mention something, but it's not related to the hospitals. It would be more related to the school. So if this is not the right place, we can worry about that later.
No, go ahead and say. So to be, if it's a training for school, because it's going to be happening in parallel. people are going to be in school. Some of them people are going to be in acute. So if there's something that we need to marry together, we need to be able to figure it out. That's fine. What was the question?
Oh, no, I was just going to say like an update on, because we were having a similar situation with the letter of invitation process for the schools. I don't know if you wanted to give everybody an update on that or not.
Oh, sure. So the training also for schools, going to school, we know when you're going to work with children is the vulnerable population, you have to have a number of permission levels to go through that school. We know that by teaching kids at US, we know that. So we ask the school to give us the letter of invitation. So there's so many procedures that they need to be done because that's in a community. It has to be under the municipal, whatever the terminology they use. We have to use those individuals to be able to give us the permission. So we have to write the letter to the director of the municipal, Mkurugenzi, so he can give us the permission to go, even to talk to the head teacher from Minazini, and then be able to bring a volunteer to that school. So that is in process right now. We send the letter via email, and then we ask one of the teacher from Minazini, Miss Clara. I think you guys probably met her before when we were discussing about training at school. So she was able to send an actual physical letter to the office, and then so gave her the secretary, and then I send the email to the Mkurugenzi to get that letter. And then so as of yesterday, Mkurugenzi has not received those things which were sent last week. So we're still working on to try and remind and try to get the response. So I believe Ms. Clara was promised that she needs to go back on Monday, and then hopefully things will be moving and she'll get the response, because they're waiting for the letter from Mkurugenzi to give it to them to take to the head teacher, and then give us the permission to be able to say, okay, now our schedule for school is this and this and this and this and this. And that's why even until now, I have not shared the schedule for school, because I'm waiting for them to give us specific, first of all, to give us green light to go in, and then give us specific day and time that how many classes that we can go and either join into the regular schedule classes or come in towards the end of the day from 1 to 4 when the children have already finished whatever the school day, and then stay behind for QHSC training. So we are still working on those details. I'm hoping by Monday we get a definite answer, and then probably by the end of the week when we're trying to give out this schedule for the acute setting, then we can have the schedule for school, and then so all the volunteers you will know. If you are scheduled for acute, and then you're going to do A, B, C, D. If you're scheduled for on a school, you're going to do that. Because remember, for school, we have vision screening, we have dental hygiene, and then hand washing, sorry. And then we have, I think Miss Claire and Miss Shani, they were talking about painting, just to give the kids hope and getting excited about that. So those are things that we are working on. As soon as we get the time, how much time allotted for us, then we can inject what the education we want to do for each grade. Remember the 7th grades. And then so we need to know how much people needs to go there. So how many people need to go there. And that sort of is going to contribute to how many people are we sending to Muhimbili for those 4 days. And that's why we were asking before for the national facilitators to come and help us. If not, then we're going to use more for our global volunteer and then adjust accordingly. There's some people who, even if you're not healthcare worker, we are going to schedule you for the go to Muhimbili for training, because we need the registrars. We need people who are going to be dealing with the pre and post surveys. We need to be people who are organizing or bringing people around. You need people who maybe just saving the runners to be able to do this. Oh, can we get this? Can we get that? And then of course, having 100 people in a day in a short time, because everybody needs to fit on those time. When they come in, they need to come in and know where they need to go. So you need to direct them. Okay, you are scheduled to this station 4. Station 4 is on the right. Station 10 is on the left. So we need to have those people who will be in there helping arranging people. So those people don't have to be healthcare workers, because the healthcare workers are going to be lined up to teach. So that's why I said, even if you're a non-healthcare worker, you're going to be scheduled to go to the Muhimbili to help, and that's how you're going to be. And as I said, everybody's going to know before we get there. So you're going to know, I'm going to wake up in the morning and I'm going to do that. And the schedule is going to be review every evening. So what did we do today? What can we improve? What was great? What was not so great? Okay, let's fix it for tomorrow. It's going to be better. So I'm sure by Friday, we're going to be cruising. And then next time we go to the school and add everybody else for school or different hospitals. So there's a lot of stuff that needs to be squared away. But the biggest part is the permission to go to Muhimbili, permission to go to school. Those are take priorities because we need those permission for us to be effectively distributed in those areas. Any questions on that, or does that make any sense, or you still have any questions?
Yeah, yes. Dr. Kabone, I have a question. When you said there's 20 minutes, we have about 20 minutes for a lesson. When I asked you another day about the nutrition portion of it.
Yeah.
Do you mean that we have 20 minutes for just nutrition, or we have 20 minutes for hand washing too? No, just, okay. Awesome.
Yes. So 20 minutes and then you get like, because remember, I mean, you're a teacher, so I don't even have to say, that when you're teaching the kids, you cannot say, okay, I'm going to teach 20 minutes. More like it's going to get to half an hour. So we say 20 minutes, right. So have at least 5-10 minutes content, asking questions. They're going to, if you have something to demonstrate, they're going to start want to touch it. I think you said you're going to have a skeleton for body parts. Okay, so they're going to probably want to touch it. So you have probably 75 students in the room. So it's going to probably drag up to 30-35 minutes. So when I say 20 minutes of content, I know there's another probably 15-20 minutes of active touching, learning, answer questions. And yes. You have something to distribute, you're going to start distributing that time. So you max up that 1 hour for you, and that's 1 hour for that content. So yeah, nutrition is going to have its own time, 20 minutes of content with everything else, probably 30-45 minutes, and then change to the next class. Hand washing is going to be that, probably sometimes hand washing and dental hygiene may go together. And then 45 minutes you're done, because by then you've already distributed the toothbrush, toothpaste, pencils, whatever we need to do in a class. So those, yeah.
Oh, good. Oh, great. Thank you.
And then you're going to have the sports. People who are doing sports outside. So you're going to spend the time outside. When you're spending time outside, remember, it's like an hour and a half. So there's other things you are thinking behind, like they might need water. Outside last time was hot. So we are figuring out a few things to do that. So yeah.
I got a question for Ms. Bahuniak.
Yes.
I just heard, so you're going to have skeletons?
Just card paper ones. Yeah.
Oh, okay.
Yeah, ones that can fit in my suitcase,
Oh, okay, good. No, because I'm thinking, and I guess this kind of adds to it. I'm thinking about donating a few games of Operation. I don't know if that would be something that would complement, I guess, whatever you're doing. I haven't played Operation in so long. All I remember is the funny bone. That was it. So
that's actually a great idea, but I don't think I could incorporate that into 20 minutes or half an hour, but we could leave it behind if you're donating.
Yes, yeah, that would be it. Maybe I guess at some point, if possible. It's an easy game to play, but yeah, we don't have to, you don't have to incorporate. We could leave it behind and get a few. The only thing is that it's so many kids. The question is how many, or how do we get them there and all that stuff like that. But no, so that's what it was. When I heard skeleton, I said, oh, Operation. So.
No, but also, I think, Mr. Pranka, you were talking about the science, inspiring science and stuff, like the light, electricity and stuff. So those are the things that if they have a science class, those are things that people could go early and hang out with the teacher doing science and play those stuff. So that could be incorporated on their time when they're teaching science on that day or whatever. So those are things like, once they give us the time, how much or how many hours we can spend at school. So then that's what it's going to allow us. Every student is going to get the hand washing, for example. Every student is going to get the nutrition. Every student is going to get the dental hygiene training. So all those things that we need to be able to match for those 7th grades for how many days they give us. So, but the science one, I mean, that's usually always good, because if this, especially if upper classes like 5th, 6th, and 7th grade, if they're doing science, you can come in there and whatever, half an hour, whatever, to share. But yes, you might need like probably 5, 6, 10 of them to be able to help people who are, I mean, the kids who are like 75 in a class. Because otherwise they're gonna cry if we only gave only 5 people to touch it and the rest, it's gonna be an issue. But I mean, those are things that we can address and try to give the hope, these kids. I mean, we give them hope so they can do better in their life. Yeah. Okay, anything else? I know some people have to go back to work, like Dr. Msambichaka. Anything else?
I have one more quick question.
Yes.
As far as the nutrition lesson, do you still want Ms. Teresa and I to go to the hospitals as well to do the lesson, or are we just going to be in the schools? Just because we're making up a lesson right now, and it would have to be 2 different audiences.
So I think it will be on the school and on that team of the athletes. Remember last time we did the nutrition for magnet? So those definitely be for those 2. Because right now for hospital, we kind of limited on the time. And so so I think if we focus on the school, because you have 800.
Yes, no, that's great. That's less work.
No, yeah, so I think if we focus on the kids, the school, children's school, and then the athletes, then yeah, I think that'll be fine.
Okay, thank you.
And then I would say too, just keep in mind, I'm not going to add another group to it, but just keep in mind that they do have teams at the school. We're not sure exactly how they're structured and everything like that, but they do have athletes at the school. So
you mean like sports team, you mean?
Yeah, you'll have your hands full whichever way you look at it.
Yeah, you'll be repeating the same thing even with your eyes closed.
Right, but it's just the athletes are going to need a lot different.
Yeah,
focus, yeah, than the typical school child. So,
yes.
All right.
Okay, so guys, if you don't have anything to say, I am gonna let you guys go because I know everybody's busy and the day is young. So thank you very much for coming and thank you for sharing your feedback. Mr. Nice, thank you very much. Mr. Jeffrey, thank you very much.